Good afternoon. It is July the 15th, 2021. I am Matthew Holt, your host of the THCB Gang. And I have a gang of my trusty regulars with me today. And we're going to discuss all that is happening and maybe isn't happening in healthcare. So who have we got on today? Rosemarie Day from Day Health Strategies. Sometimes in California, but usually in Boston. I don't know where you are today, Rosemary. Neptune from Suntra Modern Recovery. Living in the world of Manhattan. Mike Magee, medical historian from Connecticut, and Jeff Goldsmith, living in. Look! Jeff has a background of his porch in Virginia, but today he looks like he's got Hawaii or something in the background. So we're going to go live and see how everyone is today. All right. So I'm going to mix this up a little bit. I want to start, instead of starting with what everyone's noticed, I want to start with somebody to explain to me, this is not going to be about England's penalty shootout loss. All right. I want someone to explain to me all the different varieties of bills that we've talked about coming into Washington. What do we think looks like is coming out? Because I'm now seeing very contradictory pieces about Medicare expansion, Medicare doing dentistry, voting rights passing with 50 votes, now not being submitted. Does anybody have a sense of where we are? And I'm going to pick on Rosemarie and Jeff here because you guys watch this very closely. So have a sense of where we are on the kind of the legislation that we've been talking about, because over the months we've discussed infrastructure, including caregiving and all that stuff. Well, it seems to be getting a bit confused in the process. So I will shut up and ask Rosemarie and then Jeff to give me their opinion where we think we are.
I think it's very muddled, honestly, because I thought infrastructure had some potential, and it seems to be stagnating. And I don't want to throw up my hands in despair, but I'm beginning to feel like they're kind of doing the same thing they did with Obama, even though Mitch McConnell isn't technically in charge of the Senate, but we're really hamstrung. And so it's hard to say what's going to move forward, honestly. Jeff, I'd love to hear what you think.
Rosemarie, you're probably closer to it than I am. I think they're running out of time. They've got about 2 weeks to do something. And what I felt was the constraint all along is they can't add all this stuff to the deficit. So I think the real crunch is, where are they going to get new tax revenues to pay for the stuff they want? $5 trillion. I mean, it's trillions of dollars worth of stuff. $3 trillion for domestic spending, non infrastructure, and round $1 trillion for physical infrastructure, the internet, whatever. I think Biden mousetrapped himself by making the statement that only people over $400,000 in income will pay for it, because I don't think you're going to be able to raise enough through increasing the corporate tax, increasing the capital gains tax. I mean, you can't target tax increases in a way that you get anywhere near $4 trillion by doing that. So I think it's the fantasy is sort of wearing off. And then the idea that we've already thrown $5.3 trillion at this economy. It's clearly recovering, and it is clearly overheating. And so the justification for doubling the number is it's kind of hard to find. So I think, I'm a moderate ex-Democrat. I'd have a great deal of difficulty voting for another $5 trillion in federal spending. I think that's the problem.
Which goes to the question you raised, Matthew, about Medicare for all. I really never thought its prospects were good.
I wasn't raising Medicare for all. I'm raising what was. Don't forget, those of you who have very long memories around here. I know you're all young people with fleeting memories, but there was an election less than a year ago, and in the election we were told that we were going to get a public option. We were told we get Medicare expansion at 60, right? And they were the answers from Biden to Bernie Sanders saying Medicare for all. And now I hear we might get dental care, so.
Well, I think, I mean, certainly with the Recovery Act, expanding the subsidies that are available to people who are purchasing on the exchange, that's the kind of thing that like it seeps in, it takes hold. And that would be the sort of incremental change you could make either permanent or increment it again and buy some more time and keep coverage expansion moving. That to me feels like the next play, honestly. And where exactly that'll happen, and we still have a little time left before that would need to happen. But I think that's really where you'd see some movement. Lowering the Medicare age, all of those things, which are also considered incremental moves relative to a Medicare for all, are going to be tough sells financially, I think, to Jeff's point.
It's not just a tough sell financially. The hospital industry will kill both of them. The hospital industry will kill a significant expansion in Medicare because they're already losing their butts. They lose 3 times as much money taking care of Medicare patients as they do taking care of Medicaid patients. And they're really well positioned to stop the age from being lowered and to stop any significant expansion of the program. I sort of don't understand why expanding Medicaid is all that much more palatable to them. I think that's sort of being floated as an alternative, trying to figure out a way to let people that were shut out of Medicaid expansion in the 11 states that still haven't expanded, letting them go into the exchanges. I mean, that's still a kind of a possibility. But again, where's the money going to come from to do this? That's the problem.
And then let's get with the last part, which we talked about on the show, which is part of infrastructure, which is whether you would get this caregiving support in your network. I think philosophically, all of us are very in favor of that because of the big help that would give to, especially to working women and people in the sandwich generation looking after kids and looking after parents and caregivers as a whole. I've heard a lot less about that than I thought I would do from the various interest groups and pressure groups and in the conversation. We've heard a lot about, we've probably heard more about critical race theory, whatever the hell whatever that's just doing anything. Then we've heard about, the issues around caregiving and some of the other things that were sort of in that initial release of the infrastructure bill. Did we get the impression, do you get the impression the Democrats or the White House has kind of backed off that and so they just can't make it move?
I think so. Where would the political pressure come? I think, this is the ironic piece of it. The people who are doing the caregiving and even the interest groups around that, people are exhausted. We're not really done with COVID. And I work with a lot of, people at the community health center level, folks who are doing caregiving, right, left, up, down, 24/7. And it feels like there's no end in sight. And there's this pushback of, could we just have some time to breathe this summer? It feels like it's hard to generate momentum, at least from the outside of Washington right now, because I just think people are exhausted who would be pushing for this.
Well, but Rosemarie, and you will recall, we talked about this the last time we were together. The White House has done an absolutely inept job of mobilizing them.
Right.
Explaining there's 40 million people out there. If you believe our colleague Alex Drain, 40 million people out there that would be helped by this stuff, and they don't know it. So write your congressman, text them, bombard them with Twitter messages, whatever people do these days, they're not doing it. So I don't think it's just exhaustion, Rosemarie. I think it's a failure on the part of the administration to mobilize the folks that would be helped by this. And tens of millions of people would be helped by it.
Again, I think for the folks who are progressive, when you look at the attacks on voting rights, and we haven't, that's the other one that I think a lot of us would agree needs to happen, the For the People Act. And it's demoralizing what's happening at the state level. There are just so many fronts that you have to, and I think there are a lot of people who felt like, well, if we can get through the election, if we can get Trump out of here, there was kind of the hope, then we would be okay, or I could at least take a breather. I just find that like right now, I think it's hard to rally the activists. So even if the White House were doing a better job, as you submit, Jeff, I don't know if they could get the traction right now.
I would agree with Jeff. We certainly not. I mean, you can create a political narrative, and there's a lot of stuff that's gone on, right? A lot of initiatives came out early on, such as infrastructure, and I would argue that there hasn't been a singling out of some of these health-related ones that we talk about, and there's been, we don't stand. We need to know. We know it's perfectly obvious there are not enough Democratic senators to enable us, to get around this and do what would need to be done to pass any of this stuff, unless it gets negotiated. We've had, so essentially we had the agreement that we're going to have the bit of the infrastructure that the moderate Republicans, the moderate Democrats agree on, and that's really about it. And again, that hasn't even gone too far.
I don't think they're going to get nothing done besides infrastructure. I think infrastructure is going to happen, and I think there is going to be a reconciliation bill. But the question is, how much more incremental spending can they do? There, they really are hostage to Kyrsten Sinema and to Joe Manchin. They do have 50 votes. They have enough votes to pass legislation that increases federal outlays or increases taxes, both of them. They have enough votes to do that once. And they're going to have to get busy and do it.
I don't disagree with what anyone has said about the politics, both the fact that it's frustrating and complicated and demoralizing on one level. But I think it's a mistake to focus only on the politics, in that I think the culture may be evolving at a different rate than the politics are evolving. By that, I mean that if you just look, like Emerson used to say, if you wanted to see the leading edge of cultural change, you look at the language and how language is changing. And the one word that a lot of people are focusing on right now is competition, which for literally 7 decades or more in healthcare, we viewed as not only the proper motivator for progress in healthcare, but also as somehow a magical equalizer. And yet, for the 99%, that hasn't been the case. So what's happening right now with competition? Well, like Rosemarie said, this pandemic is not over. And strangely enough, the pandemic itself has become an equalizer, kind of a truth teller, a kind of a grand social experiment. I mean, as an equalizer, it showed little preference for favoritism of one class over another. Everybody was vulnerable to some extent, and the poor and the minorities obviously were slightly more at risk, but so were the elderly and those with chronic disease and those who were ignorant enough to politically posture and deliberately place themselves at risk. And as a truth teller, the pandemic exposed a lack of national health planning and our limited capacity to handle a national health emergency. So, it reinforced what many of us have said, that this is an inadequate health system, and it's brimming with inequities and with inefficiencies. And finally, as a grand social experiment of sorts, what the government proved by directly handing over resources to the citizens to basically make everyday citizens part of the favored class instead of trickling it down through powerful intermediaries. All the naysayers said that this would lead to ill use. And yet what we found is that those fears were inappropriate. The relief sustained our economy. Everyday citizens' purchases were wise and restrained, and debt was paid down while savings expanded. So, you know, in the long run, on the back end of this pandemic, once it finally does clear the air, we may find that there isn't the same faith anymore in competition as what makes capitalism vital and useful and the best form of government. It may be that we decide that providing resources, whether universal health care or other types of direct resources, housing and so forth, directly and not through these corporate intermediaries, would be a wise way to go, especially since with the internet, what we found with PBMs and otherwise is you can form Rockefeller level Standard Oil trusts in this country, and it's invisible, it's opaque, and yet it's exactly what J.D. Rockefeller did. It's a vertical and horizontal form of power grab that puts us all in the back of the bus. So I think, you know, we are seeing some significant cultural change. It may still be below the surface, but I think it's real. And I think eventually the politics will catch up with it.
So, Mike, one thing we didn't mention at the start of this is there was an executive order this week, this week, about competition.
Right.
And it was obviously the poster children for that were, you know, Google, Facebook, Amazon, and no one can quite figure out what that means because the way they operate as platforms, you know, doesn't sort of compute with traditional antitrust, you know, Marbell or Standard Oil or whatever. But there was a whole bunch of stuff about healthcare in there as well, right? There was about thinking a little more carefully about studying hospital mergers. And with Jeff, you talked about that plenty over the last 20, 30 years. They want to talk about getting off the drug pricing. I mean, I wonder, how much does that fit into what you just said? And I'm getting commentary from the background, so I'll go on mute and let you all talk.
Well, you know, you got simple things. I mean, it sounds like it's totally inconsequential, doesn't it? That Biden would say, well, you know, we're going to make hearing aids over the counter. But think about that. What he's basically saying is, you know, people are getting pretty good at managing their own health decisions. And we're going to move some of these out of the control of intermediaries. We're going to narrow the gap for middlemen in this health sector. And we're going to go direct to the customer with certain things. You know, simple moves like that, from a standpoint of looking at historical perspective, have more meaning than they might appear. It's just like, you know, as someone wrote this week, a historian from the West Coast wrote, you know, that tossing of tea into the Boston Harbor, that was really about people deciding that you shouldn't reward favoritism, whether it be to a king or whether it be to powerful corporations, which later came under the Sherman antitrust control, or FDR saying, you know, we're not going to reward these corporate royalties anymore. It's kind of a shift toward the people and away from using intermediaries that we've sort of believed since Reagan would take care of all of us through some sort of trickle down of resources.
Well, Mike, I understand what you're saying, but I mean, it really does go to the heart of a broken political system that you can't effectively separate the strong from the weak claims, unlimited dollars, and protect the consumer like you've been talking about.
Right.
I mean, I talked to the audiologists 3 years ago in Nashville, the people that charge $3,000, $4,000, $5,000 to fit you with a hearing aid. And their argument is, you can't just walk in, you can't just order one on Google and expect it to work. And there's probably some substance to that argument. The problem is, how do you decide when you need an audiologist and thousands of dollars worth of customizing and tuning and setting these things up? You know, I mean, it sounds great to say, oh yeah, you know, you can buy a hearing aid over the counter and the price drops from $3,000 to $300. But, you know, how good are we at taking anything away from anybody?
Yeah. Well, Jeff, when we seriously began considering ourselves part of a global marketplace, and at the time had a decade-long recession to provide us with moral cover to attack things like the drug lag and other things, these justified the wholesale elimination of regulation. Now, those regulations were intended to keep at bay what would be natural human greed and avarice. It was intended to give us a fighting chance against the favored class. And, by any measure over the past 3 to 4 decades, we've eliminated all these controls on corporate entities. And like I said, I don't see in the PBMs, which originated from all of the corporate power brokers in healthcare, I don't see anything but a hidden power grab and a transfer of wealth amongst those who get along by going along. And so
I'm not arguing
regulations need to be reestablished.
I'm not arguing that there aren't inequities and people being ripped off and all the rest of it. I'm back on
how do you do it?
You need 50 some odd votes to put to put the audiologists out of business or to put them on a diet.
Yeah.
The PBMs. I mean, I don't know. I read Politico Pulse every morning, and there was an arresting ad in Politico Pulse that said, "Do you realize that only about half of what you pay for prescription drugs actually goes to pharmaceutical companies?"
Right.
Yes. Oh my God, you mean the rest of it goes to the supply chain? Well, remember the Republicans, when they passed the prescription drug benefit, basically enfranchised those guys because they didn't want the federal government directly negotiating prices with the drug companies.
Yeah.
And they are now
I think
sucking tens of billions of dollars out of the public pocket by using that franchise to essentially pocket the difference between what they can charge people for drugs and what they pay for them.
I think you'd agree.
How do you fix it?
Right. I think you'd agree, Jeff, that, the beginning and end of democracy stands or falls with the vote. If you allow that vote to be rigged, you got nothing, right? I mean,
I'm back with Jeff on the 50 votes here, Mike, because we've got 50 votes. We have a Senate which is nowhere near based in terms of proportional representation to the population, and we can't. We got state legislators messing with voting rights. Very closely divided. Many very closely divided states, like the Georgias of the world. And as Rosemarie said, that one seems to be something that we're going to let sunset.
Mike, take out Biden's victory.
Right.
In 2020, right. And the Democrats got their asses kicked.
Yeah, no.
They got their asses kicked.
Yeah.
They lost seats in the House with a record turnout for their presidential candidate. They lost state legislatures that they needed to control the reapportionment process after the 2020 census.
Right.
We did have an election. And the people in favor of redistributing wealth and fairness and eliminating racial preferences and biases and all the rest of it lost the election.
Right.
So what do you make of that?
Well, I make of that we're vulnerable. And the question is, how unwise is our populace? Are we really capable of self-governance, I think is what it comes down to. If we can be so easily fooled and manipulated, I think the answer is no.
Wait a minute, Mike, why do you think why do you think Donald Trump got 11 million more votes? Was it just stupidity?
It's a lot of greed and self-interest.
Yeah, I mean,
what about cities burning themselves down and people literally taking over Seattle and Portland, taking it over, small bands of anarchists? Don't you think that had an effect on the vote?
No, I'd agree with Jeff. And you're seeing Biden talk about gun violence. You're seeing him talk about about law. We know that violent crime, which was way down for a couple of decades compared to what it was in the 80s and 90s, is ticking back up. So, I mean, I'm with you. That this is a perpetual argument, right? Drew? Are the voters? It's the what's the matter with Kansas? Are the voters too dumb voting against their self-interest? We could go on about Fox News and the Russian prop interference, and all the rest of it. But in the end, I think Mike may be right culturally, but it does come down to what there were 3 or 4 Senate seats that you'd thought should have been won by the Democrats that weren't, and that makes a hell of a difference, even though Biden's the president and we won the 2 in Georgia. And it strikes me that, where I was trying to get to with this opening section was what's actually going to pass. And my theory, my summation from the crowd is not too much. All right, can we go talk about COVID now? I want to talk about a happy topic.
Move on to a brighter topic.
And Matthew, I did want to talk about one thing.
Talk about COVID.
And Matthew,
I want to cheer you up. Hang on, JL.
And just, I think, one important thing from the proposed executive orders that came out last week was the focus on occupational licensing, which I think is something that not a lot of people really understand how important that is. How much healthcare innovation is hampered by having doctors and all other types of healthcare providers, especially in a virtual world, having a 50-state licensure requirement. I mean, we're dealing with this right now at my company. It is gotten easier. There's a lot more people doing this now, but it is still very expensive to be able to serve people in other states, because not only is there the licensure piece, there's a corporate entity piece. I mean, there's a lot of pieces that you have to put in motion to be able to serve a customer in California from New York. So I think what I'm very interested in is the proposed changes to occupational licensure. And I think I've argued this point many times on LinkedIn and Twitter. I think the only way that you change physician licensure is, I think the federal government is going to have to write a piece of legislature that requires all states to recognize reciprocally licenses in other states. And if you don't do that, it's just going to be a piecemeal march. And 20 years later, we'll still be where we are now. So I think from a healthcare innovation and healthcare delivery standpoint, I think the occupational licensing language in that publication from the White House, I thought was very, very interesting.
Yeah, there was a bunch of stuff in there, including some issues around obviously hospital mergers, and also some issues obviously around drug pricing. There's a whole number of things where you would think that if you got a very activist administration that then took that into place and actually went out and did, the next step is the FTC has to do something, right? They have to go either break up one of the big tech monopolies or do something that they have to go to a bunch of hospital mergers that are in process and either reverse them. I mean, I think it's too late on the hospital side, and I all of you look to this, but maybe break them up, reverse them, to do something. But you can imagine you take that and say, yes, we're going to change how a lot of this gets done because we want the healthcare system, among other parts of the economy, to change more rapidly and get less sclerotic. I don't know, Joe, I know that you and Roger from American Well, others have been banging on about this licensing issue, and it's clearly very, it's something that's really hampering innovation in the way that you could deliver care, especially with the remote care and the virtual care first and all that stuff that's now developing across the country. And by the way, there was some data out this week that even though telehealth is nowhere near where it was a year ago, because there are back to in-person alternatives, it's still 35 or 40 times more than it was 18 months ago, 2 years ago. So we are, and the business I'm in, and Just a Mass is not on today, but there's been, the numbers came out, the first half of this year just came out. We're at $20 billion invested in VC into, digital health innovation. So you are having forces definitely pushing on that. I don't know. It really, whenever something happens to those, and if we'd done the traditional start, I would have started with the Lown Institute, which just did a study, came out with a study this week. This is the group which is always always somewhat cynical about American healthcare and looking at patient safety and waste. They came out and they did an analysis of the amount that big hospital systems saved by not paying taxes as nonprofits compared to how much they actually did in their community benefits. And they came up with the conclusion that the amount donated by community benefits was much less for the big top 10, many big hospital chains than the amount they gained by not paying taxes. And the prime, guilty parties named were the Cleveland Clinic, New York Presbyterian, UCSF, all the big academic medical center actors you would expect. So you've got this big sclerotic healthcare system, and you can imagine it being pushed around on the policy front. You can imagine it pushed around on a regulation to executive order front, and things like interstate licensing, which make no sense. We don't have to take. I mean, it makes as much sense as the Electoral College, but we haven't got rid of that. That's kind of where I am with this issue. So, Jeff, do you have a feeling about whether you could, essentially perform some antitrust thing and do something about the big hospital systems, or is it too late for that?
Well, I think it probably is too late. I mean, there is a book came out in the last 30 days or so called Big Med by Dave Drainoff at Northwestern and Rob Burns at Wharton. And it basically looks at 30 years worth of evidence that the mergers haven't reduced cost, they've increased them. I mean, it is a grim litany of research findings that the industry has not become more efficient as it has expanded. I contributed some of that literature in my own research work, but slamming the barn door after the horses escaped isn't really going to help us all that much. Again, is our political system powerful enough to push back and demand a fair balance of benefits conferred in the tax exemption and other benefactions versus what people actually get in the way of free care and all the rest of it? We have a new administration here at the University of Virginia who basically canceled all of those lawsuits that his predecessor had filed. 36,000 lawsuits in 6 years in a county of 115,000 people. He apologized for doing this and canceled the liens that have been placed on people's houses. I think the climate is changing. I think Mike's right. I think the culture is changing. And I think that, these guys they can't come to San Francisco at JP Morgan and behave like it's freaking Davos anymore. They're going to need
that would be good.
They're going to need to watch their P's and Q's and really think hard about what benefits they're providing to society. And I think there's a lot of them. I think they've got a really good case to make, and they're not making it.
Well, they certainly provide a lot of jobs. And in my state of Massachusetts, Partners, now called Mass General Brigham, is the biggest employer in the entire state.
That's not a good sign either.
What's that?
That's not a good sign either. Where are the customers' yachts? You want to be the fifth largest employer.
So, one of the arguments that...
By the way, Rosemarie, they were only fourth on the Lown Institute's sort of bad guys list. They were beaten by New York Presbyterian, Cleveland Clinic, and UCSF.
But one of the arguments that gets made is, the significant amount of technology investment that's required to provide state-of-the-art care necessitates size and scale. And now, especially with AI coming into play, that is what I've heard some of the heads of these systems talk about, that is going to yield some of the efficiency that will, I don't know if they'll say actually lower cost, but bend the cost curve. I don't know what to make of that. I mean, it sounds good when in a speech, but I'm curious at what you all think based on your knowledge of the healthcare sector.
It's bloody rubbish. Just
it sounded smart though.
Yeah, I mean, disruptive innovation is cheaper than the stuff that was there before. Cheaper, okay? Not more expensive. Disruptors figure out a way to do something more efficiently, more cleverly, or whatever it is, and eliminate a whole bunch of the intermediaries that shouldn't be there in the first place. We've got to be courageous enough to let that stuff happen. And I don't think AI, no, there's no justification for a $20 billion health system.
That's a funny thing. I'm sorry.
Can we go to JL and then Mike?
Yep.
So Matthew, you may remember that we were on a Clubhouse where with Steve Wardell, and he talked about, what would be the year that AI takes over, becomes a dominant force in healthcare. And the number that he threw out was 2025. And I laughed and I said, you got to be joking. I mean, there are no applications now in a clinical environment where AI really makes a difference. And the idea that in 3 years from now that AI will be dominant in terms of the delivery of healthcare, in terms of facilitating decision-making, I don't believe that at all. There may be some edge cases right now where AI is making a difference, maybe let's say on revenue cycle and other places that are highly quantitative. But I think that, AI being a huge driver of healthcare cost reductions in our working lifetime, I don't think is going to be a really big component. Maybe I'm being pessimistic.
Yeah, just on AI specifically, it's worth looking at because I've been doing a fair amount in this. That, as you mentioned, there's a bunch of money has gone into, most notably into Olive, which was a couple of weeks back, another $400 million. This company's now raised $1 billion to do back office revenue cycle management stuff for hospitals, and there's clearly, I talked to a CIO about this topic. Of a big health system, and he said, "Look, we have a stack. They're not here anymore because they're out virtually on COVID. But we have a building full of people whose job it is to ring up, to harass the health plan and try and get them to pay us more. The health plans are building full of people whose job is to harass us and get us to pay us less. And that's just waste of motion. We should be able to get rid of that using intelligent stuff like AI. So I can see around the margins there. There was a company funded just this week." Called Bayesian Health, which is based on the Bayesian theorem, which those of us who did statistics have completely forgotten. But it's one of these statistical analysis things. And they were, you may remember there was a lot of controversy about Epic's sepsis prediction module, which apparently didn't work very well. These guys have been building one in Johns Hopkins. Apparently it does work very well. It predicts 90%. It's got much better. You can see around the margins that an AI will come and help that. But I think, to go to Jeff, I'm completely with Jeff here. This is not going to come out of New York Presbyterian putting itself out of business, right? This is going to come out of someone like JL or maybe Amazon or maybe one of these other organizations which says we can, look after a population. We can do this certain type of care. We can do it for half the price of the way that Toyota did it to GM in the 80s. Well, and if they're not allowed to essentially do that. If we're not allowed to take the costs out by, it's not going to happen.
Yeah. So what about the premise of like IBM Watson Health, where I'm just saying,
you laugh, but yes.
Forget revenue cycles. So that just feels like back office at the margins. It's not nothing, but the actual like diagnosis and delivery of care for the beleaguered doctors and specialists who could benefit conceivably from unbelievable AI support, so they're not having to read every single journal article or whatever and do the mental scan that the poor brain isn't capable of. I thought there was some compelling argument to be made that could make the actual physicians more productive in terms of knowledge base and access to the right kind of diagnosis, in a very tailored way, given who's.
I think these people working on sepsis at Hopkins would agree with that, and you can see a lot of this on the margins in radiology. I don't know, Jay, the stuff you're doing in substance abuse or even in when you're doing physical medicine. I don't know if there was much in those areas, but there are definitely places where you can see improvement. And by the way, there's a huge amount of money has gone into improving this front end directly to patients using bots. There are companies being funded now, more than funded. We've had a couple spacking out who've been doing these, doing chatbots / diagnostics to do triage, and I think there's still an enormous amount in there. You can also argue there are a number of companies now who are doing diagnosis in a way we wouldn't think about it. So there's a company called Ellipsis, which is a mental health company, which instead of filling out a PHQ form to figure out whether you have depression or not, just listens to your voice. And it has a very accurate rate. You can see all kinds of technology improving a lot of this piece, but.
So I don't know if it would save money, but if you could catch cancer earlier in the stage cycle, which I was in a meeting this morning talking about that. And if it seems to me AI could help that.
Well,
I agree, but to me, this doesn't justify Mass General buying yet
Oh.
more primary care groups.
I wrote a piece on this last year that no one read called Managed 3.0, The Rise of the Robots, that talked about the war between a bunch of companies that no one knows about, but that United Health Group is going to end up owning in its Optum Insight subsidiary that scrubs medical claims and tosses a bunch of them out based on algorithms, learning algorithms. AI is already present in healthcare, and it has been used to reduce provider incomes by billions of dollars. And of course, there's going to be a pushback, and Olive represents the leading edge of that pushback of providing providers with the tools to either pre-scrub the claims or to, push back somehow to get their money. So AI is already present. It's having billions of dollars worth of effect. And the people that challenged United Health Group, Optum's acquisition of Change Healthcare, $12 billion acquisition of Change Healthcare, the largest deal that's been done in tech space in the last 12 months, are challenging it based on their monopolizing essentially AI technology. So it's not like AI is insignificant, but the argument that Rosemarie made earlier, you got to be $10 billion in order to play in this space it's just ludicrous.
I think one of the questions is, where will, and maybe JL has an opinion on this, where will this technology ultimately be pointed? Because the issue, at least in my view, is not so much incrementally whether this hospital or another is great or not. I have 2 of my 10 grandchildren were in a NICU for 3 to 4 weeks when they were born. And, you come across saying, thank God for hospitals and thank God for this NICU and thank God for the doctors and nurses there. And so there is broad public support and thanks for our hospitals and even for the technology that they house there. But the bigger issue really is, how are we going to make America healthy? What will it take to, with some equity, give all Americans a fair chance to be healthy? And that question we keep sidestepping by saying, well, maybe IBM, or maybe this and maybe that can help on the margins or somehow provide a silver bullet or some silver lining. And we keep repeating the same phrasing. Even Biden, in his announcements of these 72 regulations, one of the phrases that caught my eye this week is he goes, capitalism without competition isn't capitalism, it's exploitation. And to me, he's missing the point. In a system that we have with a very narrow 1% group of favored, powerful individuals, you can take competition and turn it on its edge through lobbyists and otherwise, and neutralize any sort of equity that would come out of competition. So the problem to me is more generalized than we're giving it credit for, and it's not really fixable with incremental this or that. You have to change who is actually in the favored class. And the only way I see to do that is to somehow manage regulation better than we have in the last 30 or 40 years. Otherwise, I don't know how the Pfizers and all the rest in the world ever get affected really by competition. I mean, it's just not a fair fight in my view. So, how do you seize back control of your own government is where it comes to me. And then how do you ask the basic proper question, how do you make this nation healthy? Which, is not really that complicated a question. It's about priority setting. It's about having the right kind of governance oversight. And then it's about integrating all these great hospitals and the doctors and all the rest of it. But it isn't like you can begin with a Cleveland Clinic and build a healthcare system off of their back. Why should they be expected to do that?
You should actually be looking at the community health center model, where I've been spending a lot of time. I mean, you know, that radical idea out of the 60s, but there's so much potential to address disparities, to address preventive care in a very cost-effective way. And they are actually getting some benefit from the Recovery Act funds here to address COVID. But that's a piece of infrastructure, frankly, that we should be beefing up. And you know, it's not just about the hospitals, obviously. You know, it's got to be more about that. Not just primary care, it's the community setting and looking at the needs of individuals holistically. And frankly, I think depoliticizing it and meeting people where they are with community leaders who they trust. We talk about this a lot with the vaccine hesitancy. That's the answer. Well, it doesn't have to be just about the vaccine. It could be about, you know, diabetes. It can be about cancer screenings, all the things that would help people get healthier and stay healthy. I think it's simple.
So that's a great point, Rosemarie. And I want to, you triggered two things for me there. One is, and I do want to get us back to the COVID, because since we
because you just want to,
because I want to, and B, because so this week we had the remarkable thing where I think the state health department in Tennessee, the chief health officer resigned because
she was fired.
She
resigned, yeah,
because she was resigned because she was resigned to the fact that the state decided not only are we not going to demand or suggest that people get COVID vaccines, we're going to get rid of all other vaccine messaging as well. I've just literally just while we've been on looked at Eric Temple's Twitter feed, and he says that the latest data from the New England Journal suggests that the J&J vaccine actually does pretty well against the Delta variant, and I think the Lambda variant is coming out. We're all learning that Greek alphabet. Those of us in sororities, or fraternities. It seems to me that, you know, we are still really stuck where we have now a little mini surge going in plenty of areas against people where people are not vaccinated. We still have a lot of the world that's not vaccinated, and more America than we'd like that's not vaccinated, just in that area. And seems to me, are we kind of getting stuck there as well? I know Biden said he wanted to go house to house, and people on Fox and Friends said they didn't want to let him in, but it seems to me that this is getting even more polarized than it was around vaccines. And I just wonder, are we going to be resigned to never getting to a chunk of these people? And same thing and living in this world where we're going to have these mini outbreaks for a long time and let it mutate, and then maybe see if in the future it does come back and comes after those of us who are vaccinated?
It is sort of a Darwin test situation, isn't it? You know,
horrendous. I'm saying
there's multiple vaccines. They work. They're free. You can't send police to people's houses and force them to be vaccinated. You know, I have my stepmother-in-law, I think there is such a thing, is a Methodist pastor here in Virginia. One of her colleagues died of COVID 2 weeks ago. She refused to be vaccinated because she believed that the Lord would protect her, and he didn't. So what do you do about folks like that? What do you do about it?
You know, I'd read a piece this morning that was suggesting that folks in New England because we've almost, you know, I think Vermont's at 80% vaccination rate. Massachusetts is 70%. The states are doing really well. And they're suggesting your summer travel should be confined to New England or similar regions of the country where they've reached those levels. Don't go down south. That was literally what the advice was this morning.
Well, but the thing I don't get, and I put a little thing in LinkedIn that got no comments. Three likes.
Comment.
There's a pattern here is, why should we pay the health costs of people that decline to be vaccinated? Why should we pay them? Why should I subsidize, you know, the failure of the Lord to provide for that Methodist pastor? I mean,
look at the universities are saying you can't come to school unless you've been vaccinated. Like, you know, it's starting. That's happening.
The French said you couldn't go to a restaurant or a bar unless you've been vaccinated. About 2 million people got appointments the next day. Maybe that's
what does a COVID hospitalization cost? 50 grand, 75 grand? Who paid for that 75 grand? All of us do. Okay, so I understand the libertarian argument that you can't force people to be vaccinated. Why should they force me to pay their hospital bill?
I think this is what I was saying, Jeff, that this pandemic is not over. And on one level, it is a pretty large social experiment. And it's going to be very difficult, even if you are, a down in the wool Trumpian kind of character. It's going to be very difficult to deny the truth as time goes on. So I don't know, maybe something useful will come out of this challenge, but what's happening in the red states with COVID is no different than what they do with guns or what they've done with uneven access to Medicaid or a variety of other things. They've disadvantaged their citizens in any number of ways and haven't had to, pay the piper for it because those who were in control remained protected. So, will that last through this crisis? I don't know. Maybe this is what it takes.
Matthew, I like to think about it as like local asymptotes, in terms of the number of people who are willing, the limit of people who are willing to get vaccinated is heavily locally derived, right? It's derived by, who's around you, what your neighbors think, the media that you can consume or that is available to you. And I think that in many of these red states where you have very low vaccination rates, I think for many people, the asymptote is stuck at a very low point. But as those states start to get hit and their health systems start to be overwhelmed by the Delta variant, as they start seeing their ICUs filled again, I think the asymptote will notch up. And I think, will deeply red states ever approach deeply blue states in terms of the number of people or the percentage of people who are vaccinated? I don't know. But I do think as Delta and Lambda and whatever following variant starts to kill people in those environments that have been protected largely because they are rural environments, I think you'll see those numbers notch up.
Yeah, you're certainly seeing, Missouri is the sort of the poster child at the moment, which is now
very in Arkansas.
Head back the way it was. So, and it does seem to me that we're, that we have, maybe it's not Joe Biden going door to door, but I think there are people who are still kind of thinking it would never come here. And that message coming out, and whether it's celebrities and whatever. Again, this has been a messaging which I think the initial rollout, the anti-Slavic type rollout was done great, but it was basically preaching to people like us who were saying, go on this damn thing as quickly as possible. Yeah. When you figure out how do you get to Jeff's,
Hey Jeff, what did you do? I remember
right, it's tough.
One of these gatherings, you were, I think, heading to Montana, if I recall, and you were going to give a talk, and you had to decide about to mask or not to mask.
Well,
I was very curious what you decided.
I was in a population of people that were trying to persuade a largely, Republican populace to come to their institutions and get vaccinated. So the group of people that I was in did not accurately sample the whole state. I went to a barbecue, unmasked. I was convinced by what I saw and heard that, the people that I was associating with were all vaccinated, and they were. It wasn't as scary as I thought.
And how are they trying to approach that? If they're running health systems or whatever in Montana, or they're physicians and they, they're all vaccinated, they believe the science. How are they approaching, their communities, or were they just saying?
They're messaging. They're saying we're here. We can help you. These things work. We don't have a political agenda. We'd rather vaccinate you than intubate you. But it's interesting. One of the health systems in Montana basically mandated that all of their workers be vaccinated, and it blew up in their faces in the legislative session. And there was actually a law passed by the Montana legislature and signed by the governor that forbade them from doing it. Wow. That forbade them from requiring that their people be masked.
Wow, that doesn't even happen in Texas.
Deal. Wow. It was a big deal because their number one priority was to communicate to people that we're safe. Don't be afraid to use us. And they were being handcuffed in doing that by the Republican legislature. It was really fascinating. And there was a tremendous amount of controversy between the health system that did it and the rest of their colleagues about, could you just let them get out of town, let them leave Helena, and then do it, right?
Well, it's interesting.
A waning week of the legislative session, right, when people were looking to make a point.
Right. We're used to thinking that, you know, a lot of healthcare is scientifically or technologically derived or determined. But a lot of it, as we're seeing in actions just like this, is they're culturally determined.
Right.
You know, if people have these belief systems, and that's why I say basic questions like, how do you want to make this country healthy? You know, that's a very basic question. And the answer to it isn't really simply about good technology or science. It's about all these social determinants that people are waging cultural wars over. So, you know, I think we got to force those basic questions out into the open. And I think part of that is where's the favoritism in this country going? Who's got the power and who's doesn't have the power, you know? And why? You know, why is it that I can't get a fair shake in this nation that supposedly is based on giving everybody a fair shake? Why is that impossible? So anyway, yeah, you know, I mean, I guess a lot of this we all sort of take for granted, but I'm just saying, I feel like we talk past it. Like when Biden says, hey, the solution to this is better competition, I say to myself, no way. You can't compete with these characters. They got all the money and all the power. You got to do something else.
All right. On that hopeful note, I'm going to go around with 5 minutes to go.
He's trying to fend off the socialism critique, so he's got to throw the competition word around. Right, anyway, right. Matthew wants us to wrap up.
I'm not it, but what I want you to do is this. I didn't get you to do this at the start. I'm going to ask you to do this at the end. Is to tell me a nugget that you've thrown up this week. I gave you the nugget about the Loan Institute and their community benefit versus non-tax, not paying taxes for those big non-profit systems. I want you to come up with give me as we go a nugget for that you've found this week that just in a few seconds, and then we're going to do the traditional, and then that's the next thing is, and then what are you looking for, going forward? So I'll start with you, Rosemarie. Give me your nugget that you noticed this week.
Well, I'm listening to Ibram Kendi's book, How to Be an Anti-Racist. So I may be a little behind the curve. I think a lot of people read it last year, but I'm catching up. And the nugget was his statistics about the Florida election, Bush v. Gore, where I have quoted it was lost by, 572 votes or something like that. And in fact, there was so much voter suppression going on, which I was completely unaware of. He threw out a number like 118,000 votes were suppressed that would have gone for Gore. And that was something that I found astounding, but not shocking anymore now that I see what's going on. I just think we've all had a narrative, or I say we, not every, but there's been a narrative, a prevailing narrative that's even used in voter campaign things, door to door. Florida was lost by 572 votes. And now I'm going to have to go back and look at all that again with a new.
Same things happening. There's been happening in Georgia in terms of, the governor Kemp taking people off the list.
Yes, but it goes back way further than the narrative. The prevailing narrative.
1619 and before, right?
Well, true.
and certainly the 60s for sure. Right. And do you have what are you looking for in healthcare coming up?
I'm going to stick with my community health center work and the hope that I see there, and trying to get past the politics and go to the community level and really work from the ground up.
Right. Mike, what's a nugget you've seen this week, and then what are you looking for next?
Well, the guy that I've enjoyed watching this week is a guy named Dan McKee, M-C-K-E-E, who took over for Gina Raimondo as the governor of Rhode Island when she went into the Biden administration. And he was the number 2 there and got appointed to governor. And he is known as for being a retail politician. Grew up in Cumberland, Rhode Island, knew every mayor throughout that small state because he owned a small oil company. And so he now has been executing his specific brand of retail politics and leading with the vaccine campaign, and has, if not the highest, close to the highest state in the nation for 2 vaccines at this point. But what I find interesting about him is, even though he's a retail politician, he's got a great social media and communication staff. And so every day he's all over the social media, and he's managed to tie all of his progressive programming back to the vaccine effort, and to jobs, and to workers, and to favored class being extended to all of his people. So I think, you know, he's an interesting guy to watch, even though it's the smallest state in the union.
I think. Jeff, what's your nugget for the week, and where are you going?
93,000 people last year, pardon me, killed themselves with drug overdoses. 93,000, a 30% increase over the previous year. It just blew me away. And we are losing more people every day to overdoses than we are to COVID.
JL, that's something great.
And it's not a crisis.
Well, it is.
It isn't a crisis in the cultural, I mean, it's a horrible thing that's happening, and almost no one seems to be aware of it at the level that would catalyze the actions that are required to bring it under control.
JL, well, that's a topic very close to your heart, but what else have you been looking at, or what have you dug up in the last week or so?
Sure. I think something that I saw many other people saw was Roe is on a acquisition rampage, and they acquired a home diagnostic company called Kit, and they've acquired a couple of other companies in the last 12 months. And it's very interesting, having been in this space for a long time. As you may remember, I was at Blueprint Health, ran the accelerator there for a couple of years. You know, one of our challenges back in 2016 when we were in our last class was exits for companies in our space, you know, compared to, let's say, general tech companies. We just didn't have a Google, we didn't have a Facebook to facilitate smaller and medium-sized exits. And it's interesting now to see a company like Roe, and there will be many others, I'm sure, that are creating exit opportunities, creating liquidity opportunities, and, you know, at the same time, obviously consolidating these technologies in a way that could either be more useful to other people or could be more in the monopolistic kind of way that prevents competition. So interesting what's happening in the space right now, having been in the space with you for many years now.
Absolutely. And on that note, behoves you to mention, I'm running a conference with Jester Massa, who's not this week, called Policies, Techies, VCs. I'm really lining up all those CEOs. And the notable difference between doing this when I did it Health 2.0 back in 2007, 8, 9, 10, all the way through 17, and doing it now, is that in those days, if you'd raised like $5 million, you're probably a big deal, and I would like to get you on a panel. Now, if you haven't raised 50, you probably don't get on. You probably don't get an invite from me. So it's interesting, and we have a number of companies that are on SPACs and IPOs, and whether or not any of them are going to make any money is another issue. But certainly that the sector is just, as we mentioned earlier, it's just grown dramatically in terms of the money coming into it, and hopefully we'll see whether this all makes a difference or not, or doesn't. Okay, and with that, I'm going to wrap the conversation for this week. I want to thank my panelists. Another great chat. We seem to go up and down from the micro to the mini. Come on, I'm trying to. Here we go. I had today on with me on THCB Gang, Rosemarie Day from Massachusetts, Day Health Strategies, JL Neptune at Suntra One Recovery in New York City, Mike Magee in Connecticut, but hanging out in Rhode Island apparently a little bit these days, and Jeff Goldsmith from Health Futures Inc. in Virginia. Thanks to all of them for chatting with me. Thanks to all of you, whether you're watching live or listening later, or either on the video or on the podcast. THCB Gang will be back, I think, next week, although I might be going on a lightning vacation, so stay tuned. But we'll certainly, if we are back, we'll be back on Thursday at 1 p.m. Pacific, 4 p.m. Eastern, and we'll definitely be off the next week, because that is definitely a vacation week. But we'll see you in August. Thanks for watching.